Thank you for joining us this afternoon. I'm Rebecca Donnell. I'm the Deputy Director of the Waiver Renewal Project, and I'll be your presenter and facilitator today. You heard Michelle and I talking. We'll get started here in a minute, but before we do, I'd like to go over a few housekeeping items. I should have given you my pronouns too. So I'm Rebecca, my pronouns are she, her, hers. Wanted to make sure I covered that. We expect a pretty large group today. We had close to 300 people sign up. We have 100 who've already joined us and are in the room with us today, the virtual room. So it's really important with a large group like this that everyone put themselves on mute when they're not speaking. So if you haven't done that already, can you go ahead and put yourself on mute? And then when you're ready to ask a question, you can raise your hand or you can take yourself off mute and ask a question. You can also put your questions in chat. But when you're not talking, when you're not asking a question or commenting, please keep yourself on mute so that we don't have any distractions, background noise, that kind of thing. This meeting is being recorded. Just want to make sure everybody is aware of that and that it'll be posted to our waiver website, our 1115 waiver website. So if you want to go back and listen again, or you want to forward it to someone else so that you can listen to it, they can go there. You can also update your Zoom profile to display your name and the organization you're with if you want to do that. Please try to use the hand raise function in the Zoom under the reactions to get recognized to be called on to speak. When you are called on, if you could just state your name and your organization, that would be fabulous. We'd love that. Closed captioning is available. To access closed captions, click on the live transcript button on your Zoom toolbar. Language interpretation is also available. To access interpretation services, click on the interpretation button on your Zoom toolbar and select your desired language. We'll have several breaks throughout the presentation for questions, so you don't have to hold all your questions till the end. We'll have some stops throughout the presentation where you can raise your hand and ask a question or put them in the chat, and then we'll answer as many as we can and then keep going. If we don't get to your question, we're going to collect all of the questions that are in the chat. So if we don't get to your question or don't get to you with your hand raised in time today, please put your question into the chat and we'll follow up with written answers that we'll post on the website. So with that, I think we're ready to get started. Again, I'm Rebecca Donnell. I'm Deputy Director on the Waiver Renewal Project. I'm here to talk with you about Oregon's Medicaid Waiver, 1115 waiver. It is the blueprint for our Medicaid program, the Oregon Health Plan, here in our beloved state of Oregon. So just quickly, a little bit of background for folks who may not be familiar with the waiver and how it relates to Medicaid. Medicaid is a federal program that each state administers, and so each state might have a different name for it. Here we call it the Oregon Health Plan, and each state administers or delivers their Medicaid program slightly differently. Here in Oregon, we have managed care organizations called coordinated care organizations that are the local Oregon Health Plan administrators, and they cover our medical, dental, and mental health care benefits. And currently, it's closer to 1 in 3, I think now, but 1 in 4 in Oregon get coverage through the Oregon Health Plan. Next slide. Perfect, thank you. So what is a waiver? So all Medicaid programs have eligibility criteria, and folks are eligible for the Oregon Health Plan based on their income and for other reasons like residency and those types of things. The federal rules set the minimum standards related to eligibility and what we must include in our Medicaid program. But states can ask to waive some federal rules to give us more flexibility in offering the Oregon Health Plan. We can ask to serve more people. We can ask for paying for services differently. We can ask to cover more services than are usually allowed. And Oregon has been asking the federal government for a waiver for many, many years. It goes back decades, actually. And so every 5 years, we renew our waiver with the federal government. And we go through a process where we develop concepts that are then vetted with the community, and we gather lots of community input to help shape those concepts that go into our Medicaid waiver every 5 years. And then that goes into an official application, which gets submitted. Ours just got submitted in February of 2022, and then starts a negotiation period with the federal government, specifically the Center for Medicaid and Medicare. And so then over a course of months, so from February to September of this year, we were in negotiations with CMS about what was going to be included in this renewal of the 1115 waiver for Oregon. And during that negotiation process, the federal government can accept or reject the different proposals that Oregon had included in its application. And so what we're here today to talk about is to share what got included, what was approved by CMS, and what is going forward in our 1115 waiver as of October 1st, 2022. Next slide. Next slide. So just to ground everyone, the fundamental basis for our Medicaid waiver for 2022 to 2025 is focused on advancing health equity. That is our main overarching goal. That is what all of our different proposals and concepts and strategies are focused on. We've broken out that main goal of advancing health equity into 4 subcategories, and they're ensuring that folks can maintain their coverage. So ensuring folks are able to maintain their OHP benefits, improving health outcomes by addressing social needs that impact health. So we know that folks have needs that are outside what we consider traditional medical care or dental care that greatly impact their health, those things like housing and food and those types of things. So we wanted to make sure that we were able to address those types of needs. Ensuring smart, flexible spending for health equity. So thinking creatively about how we are using our Medicaid dollars to have the most impact and to make sure that we're reaching folks that aren't getting access currently to the healthcare system because we have challenges in our system, and we need to really kind of correct things to focus on equity. And then creating a more equitable and culturally and linguistically responsive healthcare system. So again, more systems-based approach where we're looking at, are we fully meeting the needs of our Oregon Health Plan members? What are they telling us? What do they need? And are we truly delivering the services that they and their family members are looking for and need to have high quality care and health over time? Next slide. So this is the exciting part when we start talking about what actually got approved in the waiver and what does that mean for Oregon Health Plan members. So what's changing? Well, let's focus first on enrollment. And I'm excited to announce that Oregon is groundbreaking in its new authorities to be able to allow kids to stay enrolled continuously through their 6th birthday. So if there's changes in income, any kind of fluctuations like that, it doesn't matter. Kids stay enrolled through their 6th birthday and have continuous coverage. For everyone else on the Oregon Health Plan, so children 6 to 18, children and adolescents, I should say, 6 to 18, and then adults over 18, they automatically stay enrolled for 2 years instead of 1. So again, regardless of if fluctuations in income, those types of things, which in the past, we've redetermined whether or not people have been eligible based on that. We're going to say, no, once you're enrolled, you get 2 years of enrollment before we use that information again to see where you're at and see if you're still eligible. And for those kids under 6, it goes through their 6th birthday. So that really provides some stability for families and individuals by increasing the length of time that they're continuously enrolled. Next slide. So what does that mean for our Oregon Health members? It means that they're covered longer, so they stay covered longer. They'll have to re-enroll and do paperwork and go through the process of resubmitting information less often. And they're less likely to lose coverage because of short-term changes in their income or other types of eligibility. So this means that they can really focus on getting the preventative care that they need and being able to tackle health conditions that they need to. So having that stability will help people be able to better maintain their health. Next slide. I'm going to pause here. Seems like a good place to break and see if we have questions. Michelle, if you could help me see if there's questions in the chat. I'm going to be looking to see if there's hands raised.
There aren't any questions in the chat, but George Adams has a question.
Oh, great. Hi, George.
Hi, Rebecca. Nice seeing you again.
Yeah.
With the 2-year deal for adults, whatever, for like 2 years.
Yeah.
How is that going to affect people that are dual eligible, Medicaid, Medicare?
They also qualify.
I mean, once the 2nd year is up, how's that going to be predetermined to become dual eligible again?
I'm not sure I understand your question. Why don't I take your question and we'll follow up to make sure that I'm understanding it correctly. So they're considered an eligible population for continuous enrollment for those 2 years. And on the Medicaid side would be redetermined after those 2 years to continue to be dual eligible. Beyond that, why don't I take that question and follow up and make sure I have a subject matter expert look at it and make sure I'm answering it as fully as I need to be.
Okay, because there's a lot out there that's still eligible, Medicaid, Medicare, and this 2-year thing may hope they don't mess them up.
Thanks for your question. I appreciate that.
Okay.
Does anyone else have a question? Looks like Myrna. Do people still need to report a change in income within the 2 years? Yes, so people will still be updating their contact information, their residency, etc. They may continue to collect income information, but they're not using any of that information to determine eligibility during that 2-year period. I can't say definitively if they will or will not be collecting that information during that period of time, but they will not be using that information for eligibility purposes during that period. Does that answer your question, Myrna? Great. We've got a little bit of time if there's another question. Okay, if not, let's jump back in. Okay. So the next slide talks about some other new flexibilities and benefits that we were able to gain through this renewed waiver. And under the new waiver, OHP members will get increased access to social supports in more situations. So some of these situations include when you're leaving the Oregon hospital, Oregon State Hospital, or other psychiatric facilities, or jail or juvenile corrections or prison, that we consider these times of transition, times when people are vulnerable and need to make sure that they have extra supports to make sure that they can continue on and maintain their health. And so during these transitions, folks will have access to some added benefits, some added social supports. Also, for folks that experience extreme weather events, we're going to make sure that folks have access to some important things like air conditioners, air filtration devices, generators for their medical equipment, and so on. If there's an extreme weather event in the area and people are vulnerable, they'll have access to those additional equipment and supports. Youth in foster care who are transitioning out of foster care, again, folks that are vulnerable in transition, youth with special health care needs, they're going to get added social supports as well as increased vision and dental services, and then housing supports for people experiencing homelessness or at risk for homelessness. Next slide. So under housing, the benefit package around housing supports will include rental assistance or temporary housing for up to 6 months, such as rent payments or rent deposits, utility assistance for up to 6 months, some home modifications, things like handrails, ramps, etc., pre-tenancy and tenancy supports, such as help with rental applications or moving, and housing-focused navigation and case management. Next slide. In terms of food supports or nutrition supports, folks that are eligible and qualify for these supports can get access to community-based food resources, such as application support with SNAP or WIC, nutrition and cooking education, fruit and vegetable prescriptions, and healthy meal box delivery, and then medically tailored meal delivery. And it's also, in terms of all of the food services, there's an emphasis on making sure that the food is culturally appropriate. The food and the services are culturally appropriate for the folks who need them. Next slide. In terms of those climate events, like the heat dome that we experienced last year and the extreme weather and wildfires that we've been having here in Oregon, again, if somebody lives in an area that is experiencing a climate event declared by the governor or the federal government as an area in an emergency situation. Payment for devices to maintain healthy temperatures, make sure people's houses don't get too hot. So air conditioners, clean air filtration devices, including air conditioners, heaters, air filters, etc. And then, as I mentioned before, generators to operate critical devices, medical devices like ventilators when there are power outages and things like that. Next slide. So what do these additional supports mean for Oregon Health Plan members? Right now, we have very limited supports for housing, food. If there's a climate event, we have some limited abilities to be able to provide some of those services through our CCOs. And our CCOs provide flexible services under what's called health-related services, but those are limited and they're not unified across all CCOs. All CCOs offer some sort of flexible services, but they're not necessarily identical across all of our care organizations. And they're not considered covered benefits. They're not OHP covered benefits. These new social supports that I just described to you around housing and nutrition and climate event supports, excuse me, they are covered benefits under OHP. That means everyone who qualifies for the benefit is entitled to receive it. So these are baked in, they are part of the Oregon Health Plan, and they're a benefit that eligible individuals and family members can receive. So that means that Oregon Health Plan members who are facing certain life challenges will have these extra supports available to them to stay healthy during times in their lives where they're experiencing greater needs. So if you can think about it, if someone is homeless and they're in that transition phase, we're wanting to help them find housing, find temporary housing that's going to help stabilize them and let them focus on what they need to focus on and make sure they're able to maintain their health while they're trying to get into longer term housing and the like. Next slide. So this is just a graphical. Some people like to see things graphically to be able to understand them. And this is a nice way for us to show graphically the difference between health-related HRS flexible services and these new benefits that I just talked about, which are called HRSN services or health-related social needs services. As I mentioned before, we do have HRS flexible services that are offered to CCO members through their coordinated care organizations. They can request some supports, things like air conditioners, things like maybe they need something changed in their house. They need, railings added or things like that. They can go to their CCO and ask for flexible services and to be considered for receiving those. Those aren't offered to Oregon Health Plan fee-for-service members, and the criteria across coordinated care organizations for receiving those types of services, again, are not necessarily unified, but they are available to all CCO members and will continue to be going forward. The HRSN services are Medicaid covered benefits. So again, they're guaranteed benefits for the people that are qualified. They will be offered to fee-for-service enrolled OHP members as well as CCO enrolled OHP members. And they're for those transition populations. They're really focused on folks that are going through a life change that is a critical life change, and to make sure they're able to navigate that and get the supports that they need. Next slide. Let's pause here again to see if there's more questions. Okay, looks like we've got some questions. Okay, I see Elaine's question. Is it 2 years before reapplying for anyone who applied in the last 2 years, or does the 2 years only apply to people who have applied after the waiver is effective? So this will go into effect at the end of the public health emergency. So the new benefits of continuous enrollment, all of the continuous enrollment benefits that I described, the ones for children aged 0 to 6 and everyone 6 and older, those will go into effect starting when the public health emergency ends. Next question from Lynn. Has the process for medical staff and or CCO members to access these supports been standardized across the CCOs, or is it still different? A big part of the problem has been providers often don't know options to help or access them. Great question. So with the new services, the health-related social needs services, they will be standardized across all of the delivery system, the fee-for-service as well as the CCOs. And so we'll talk about the timeline for these benefits to start being offered. We have a year from the time that the waiver was approved this October to implement, to plan and do the implementation with benefits starting in 2024. So that's part of the work that needs to be done over this next year, is the standardization. But that is the plan, is to make it standardized because it is a covered benefit. Will there be a limit to how much flexible spending a member can have? No, these are benefits. So if you qualify for the benefit, then you are eligible and have access to that benefit. How might providers request the social services for their clients, and how might they be paid out? So that will depend on whether or not the individual is enrolled in fee-for-service or through their CCO. And again, some of those details are TBD as we are in the planning phase right now. But what I can tell you is that they would go through a process for fee-for-service if they're a fee-for-service member, and they would go through their CCO if they're a CCO enrolled member. How exactly those requests will be made, that's TBD, because, or to be determined, because we're still planning out those details and really getting into the nuts and bolts of how these benefits will be accessed. How might a community-based organization that can provide support for any of these areas go about connecting with the 15 CCOs? Is there a specific type of contract CCOs stand up for these types of services? Great question. I'm going to take that question and answer it in written format afterwards. But generally speaking, we are going to be working with community-based organizations to increase their capacity in these areas of support, housing, nutrition services, climate support, and working with the CCOs to connect with those community-based organizations that can provide a network of care across the state around those social needs. So great question, and more to come on that, and we'll follow up in written format later. I see there are 3 more questions at least. I'm going to move on just for time's sake, and then we'll come back at the end of the presentation and answer lots more questions before we wrap today. Okay, so now we're going to talk about next steps and opportunities and what we're continuing to work on. So the Medicaid waiver, the renewal, was actually signed for approval on September 28th, 2022. So it was just signed in September. It went into full effect. It went into action October 1st, 2022. There were some things that when we were talking with the federal government, with the Center for Medicare and Medicaid Services, that they were very interested in continuing to discuss with us that we wanted included in our 1115 waiver, that there just frankly was not enough time for us to work through all the details to get to confirmation of all of those other services by the end of September. And we had already extended our waiver and didn't want to go past the waiver extension. But they said, we'll continue to work with you on these other items, and you can roll them into your waiver as we work through them and continue to work through them. So there's a few things that are on that list, and they're tribal related requests. And we're currently, as of last week, working on tribal request, or the week before, 2 weeks ago, working on the tribal related requests with the tribes, and that's going well. So we're in active talks with CMS about that. We're also continuing to talk with CMS about coverage. So 90 days of OHP coverage before folks leave Oregon State Hospital or prison, jail, youth corrections, etc. We know that if folks were able to have coverage before they were going to be leaving those institutions, that they'd be better prepared to go into services that they need upon leaving, things like substance use treatment, mental health services, medical services, dental services that they need. And so the lag time after someone leaves and getting those OHP benefits going again sometimes is a huge barrier for folks. And so we are continuing to work on getting that 90 days of coverage for members before they leave custody. And then the community investment collaboratives, and this is work around health equity, localized work to fund health equity efforts. And we're continuing to talk with CMS about what those projects and what those investment collaboratives might look like. Next slide. I alluded to the timeline for when certain things would be going live, and the general kind of path that folks will use for implementation of all these great approvals that we receive through the waiver. As I mentioned before, the waiver got signed at the end of September and went live October 2022. Part of the waiver that we didn't touch on, which was early periodic screening, diagnostics, and treatment, will go live January 2023. That's the only new part of the waiver that will be going live in 2023, at the start of 2023. When the public health emergency ends, whenever that is, tentatively, we think it'll be sometime around the spring of 2023. There'll be a process of redetermination, and that's when those continuous enrollment benefits that we talked about earlier, that expanded eligibility for continuous enrollment, that's when that will begin. So sometime probably spring 2023, but it is contingent on the ending of the public health emergency. And then we have a whole year where we're going through the planning process for those social support benefits that we talked about. So the housing benefits, the nutrition and food benefits, and the climate supports. We have a whole year to work with coordinated care organizations, to talk with the community, to work through with the fee-for-service program to figure out exactly how folks will access benefits and who the providers, the local community-based organizations that will be the providers, who they will be. We'll be working on that in 2023 for a January 2024 launch of those types of benefits. Next slide. Okay, so open-ended question. Take any kind of question. Also would love to hear how we meaningfully engage with you and your communities over the next year around the waiver. Going back to the chat. I think I left off on Barbara. Where can someone go to find a list of the health-related services? It's on our waiver website. And I think I saw someone dropped the link to the waiver website with more information in the chat. Jamie, does OHA have an estimate of the percent of the entire CCO population that might be eligible for transitional benefits? Yes, there was very rigorous analysis that was done to look at who might be eligible for these different benefits. I don't have those numbers, so I don't want to guess and provide inaccurate information. So Jamie, I'm gonna say we're gonna follow up in written format and get you the right information. But yes, we did do estimates to see how many people would qualify. Summer. Who is managing the definition of homelessness? Will this be identified on our eligibility file, or will CCOs identify the population that is eligible? So we're using the HUD definition of homelessness, and we're figuring out exactly looking at the HUD definition of homelessness and all that's included in that, and figuring out how we will be identifying folks, but it will be based on that HUD definition. And whether or not it will be the CCOs that will be identifying folks, OHA, or providers, or community-based organizations, I think is to be determined. It may be all of those entities that are involved in identifying folks that are in those transition populations. Will the need for rental or utility assistance need to be 6 months consecutively? Will this be a one support, or will the benefit renew? Christina, I'm going to have to go back to our specific language in the waiver and follow up with you in written format on that question. I believe it needs to be consecutively. But I need to check that and get back to you and follow up in writing on our website once we've been able to verify exactly what the language in the waiver says. Is there enough workforce to be able to keep up with the changes? I think that's a very good question. We are looking at ways that we can do capacity building to support building the infrastructure to be able to offer these services. It's certainly maybe not a light switch approach that this will be something that we begin to do in 2024, and then we keep building all the different components, building the workforce, building the technology infrastructure, all of those things to be able to continue to add these types of benefits to the Oregon Health Plan. So it's not something that's just going to be a light switch overnight. We have everything we need to be able to do this. We do have a year of planning. But it'll be something that happens over time, and we're being funded over the course of the waiver, which is 5 years. So it will likely take us several years to be able to build up what we need to be able to deliver the services. Lisa put the link to the health-related social needs. Thank you for that. Thank you for doing this. And Yvonne, I see your hand raised. Does the fact that, I'm going to take Christy's question and then I'll come to you. Does the fact that the incarcerated population and the things going into effect 90 days to prior release, is that still being talked about? What CMS mean that this population can access the HRSN benefits only after release versus being scheduled before to occur after release? So there may be some opportunities. I don't know how cut and dry it is for right now. The benefits are for folks that are in transition, leaving the Oregon State Hospital or jail, prison, youth corrections, etc. And so they're really not that 90-day prior benefit. They are that post-release benefit. How soon they would be able to start working with a CCO to be able to have access to those benefits upon their release, I think is, again, needs to be worked on and determined. And it may be the case that it is post-release only, but I think there is every effort being made to figure out ways to be able to get folks these very necessary services as soon as we possibly can. Can you tell us about what communications from OHA child health providers might receive about EPSDT services and coding? I'm going to have to take that one, Julie, and follow up. In writing and get back to you, unless someone else who's listening today has some specific information from OHA. And then I think, Yvonne, I don't know if you still have your hand raised. Yeah.
Yes, hi, this is Yvonne from Oregon Community Programs in Eugene, Oregon.
Hi.
Hi there, and I was curious if there was going to be a timeliness standard implemented for CCOs reviewing the flex spending applications. I have had feedback that sometimes it takes several weeks to a couple months, to review something and to even get an answer. So I'm wondering if timeliness standards might be implemented for the review of those applications.
I know that we are looking at ways to work with CCOs to do some continuous quality improvement around HRS. That's not something that's related to the waiver, so I can't speak at length about it, but we will take that feedback. This is a great example of how we get feedback from the community about something that's not working. So what I can say is we'll take that question and take it back to the HRS team here, provide them that feedback, and follow up. Again, we'll make sure that's followed up in written format afterwards. It's a little bit out of scope for the waiver just because it's not something we're addressing, but I appreciate the question, Yvonne.
Great, thank you.
Philip, will this slide deck be available? Yes, it will. It will be on the waiver website, and Michelle answered that question. Fantastic. Thank you. All right, Connie, regarding your question about engagement, small think tank webinars would be great, and regular email updates are welcome. Also, if it's clear who from your team plays point for a community-based organization and provider questions, that would be very helpful. Oh my gosh, such good feedback. Thank you, Connie. That's very, very helpful to know that's how we could meaningfully and engage with you and the folks that you work with in a way that would be useful. And wow, thank you. That's great feedback. We will take that. Kate Budd, please meet with a continuum. Please meet with a continuum of care in each community as part of planning outreach efforts. Okay, Kate, same, really appreciate the feedback about how we can engage with folks in the community. Make sure we have a continuum of folks, not just meeting with a few individuals. And then Manu, with Medicaid waiver approval, please review again the timeline for implementation. So could we go back a slide? So again, so we just got approval in October. Well, technically the end of September, September 28th, we signed on the line. The waiver went into effect October 1st, and that means that we are now operating from this new waiver that has been approved by CMS. And January 2023, EPSDT will go live. So that is a change that starts as of January 2023. In what we estimate the spring of 2023, we think that the public health emergency that the federal government will say that it's ending sometime in the spring, and that's when redetermination will begin. And at that point, those eligibility categories, the children 0 to 6 will begin their continuous enrollment for 6 years, or up to the age of 6, I should say, up to the age of 6. And for everyone else, 6 and older, ages 6 and older, that's when those 2 years of continuous enrollment begin. And then we have been working on implementation planning even before the waiver was signed on the dotted line, in anticipation of these health-related social needs being included. We have till January 2024 to work with all of the different entities that will be involved to stand up those services. Okay, I see Christina. Thank you so much for holding these meetings to share updates along the way. This is such an exciting change to be a part of. I know it is. It's really exciting. And I should have underscored more just how visionary and what a leader Oregon is around all of these new approvals that we got in our waiver. And so we are first in the nation to offer many of these different new authorities that we got approved through the federal government. And so, you know, no one else is really at the cutting edge like we are to be able to include social needs in their Medicaid plan benefit package. That is truly groundbreaking. And Oregon is pushing the envelope and working with the federal government to say, our Medicaid members, we know that these things impact their health and we need to be able to address them. And we need to be able to do it equally across all of these different transition populations. So I just thank you. It is exciting. It's kind of gives you goosebumps when you think about it. When is the next CCO RFP process for community coverage? I don't know that. I don't know when that starts. Maybe someone else knows, or we can take that and follow up. Manu, thank you. Thank you. And Barbara, awesome, much needed change. Go Oregon. Yeah, go Oregon. 2 people have hands raised. Let's see here. I see Yvonne, is that a new hand or?
My apologies, it didn't lower.
George, how about you? Is that a new hand? George Adams.
Yes, it is. Sorry, the microphone. One question is, with this being like it is this going to all come together before the new CCO contracts come January, February of 2024? And will the CCOs be held by doing matrix on this side of thing when this works?
Can you say the last part again, George?
Well, the CCOs have, you sit matrix from OHA to do matrix on this new waiver 1115?
Yeah, so what I can tell you is these are covered benefits. So in order for them to be offered across all of the CCOs, is they would have to be included in the 2024 contracts. And so that is the intention, that they would be services that would be included in the 2024 contracts. I'm not sure what you mean by matrix stewards, so I can't really speak to that, but what I can say is that these will be uniformly delivered by the CCOs and fee for service because they're a covered benefit. And so they'll need to be offered to all eligible members.
Okay.
Do we have any more questions? Well, if we don't have any more questions, I just want to thank everyone for attending today. We appreciate you coming and listening and learning about the Oregon Medicaid Waiver, 1115 waiver. It's nice to hear that you appreciate these updates and would like us to continue to do them. That's helpful to know. I want to thank all of my team members who helped make this happen today. We have Audrey and Fabio, who are interpreters, who've been supporting behind the scenes. Lee's doing closed captioning. Lisa is doing chat and helping with questions. And Michelle has been helping me from the get-go get this webinar arranged and off the ground and do coordination. So I just thank them all, and I thank you, and have a great holiday this week.
Hi, Rebecca. Just a really quick question. Are we going to continue to get some updates, these meetings continually as we move forward?
Yeah, there'll be opportunities for continued engagement. I don't exactly know what that schedule will be, but you can check the waiver website, and we're posting the schedule of opportunities as they become as we organize them, I guess I should say.
Thank you.
Yep.
Thank you. Have a great day, everybody.
Bye, Michelle.
Thank you for joining. Have a good evening.
You too.